Before you book that expensive MRI or another round of x-rays, stop. Because there's a simple blood test that can save more than just your knees. Weeks before Christmas, it's called the HSCRP test. And this tiny test can reveal dangerous inflammation weeks before it shows up on a scan. It's fast, it's affordable, and it's something most doctors don't even mention, even though it can detect the kind of hidden inflammation that leads to chronic joint pain, arthritis, and even silent heart disease. Most people never hear about it until it's too late. But this holiday season, you can change that. Because catching it early could mean fewer pills, fewer doctor visits, and a lot less pain in the new year. It's that time of year again. Cooler weather, cozy sweaters, family gatherings, and for millions of people, aching knees. You bend down to wrap gifts, climb stairs, or stand for too long while cooking. And suddenly your joints remind you that something's not quite right. The pain might be dull or sharp. Maybe it comes and goes. Maybe your doctor says, let's do an MRI and see what's happening. But here's the shocking truth. An MRI might not be the answer. In fact, a growing number of doctors are discovering that the real problem isn't mechanical, it's chemical. And that means it's not what's broken in your knees, but what's brewing in your blood. That's where a simple low-cost inflammation blood test comes in. One that could reveal the early warning signs of both joint and heart damage, long before any MRI could. 1. The MRI. Myth: why it's not always the answer. Let's get one thing straight. MRIs are great for detecting structural damage, things like torn ligaments, cartilage loss, or bone issues. But here's the problem. Most people suffering from everyday knee pain don't have a visible tear or injury. Instead, their pain comes from something MRIs can't easily detect: chronic inflammation. Inflammation is invisible on a scan, yet it's what slowly eats away at your cartilage, stiffens your joints, and, shockingly, raises your risk for heart disease and stroke. Think of inflammation as rust inside your body. You can't see it on the surface, but it's quietly corroding everything underneath. So while an MRI might show you a normal knee, your blood could be revealing a completely different story, one that's far more dangerous. 2. The hidden blood test that changes everything. The test that's changing how smart doctors look at pain and aging is called the HSCRP test, short for high sensitivity C-reactive protein. It's a simple blood test that measures how much systemic inflammation is in your body. When your CRP levels are high, it means your body is in a constant state of alarm, as if it's fighting off an invisible threat. And here's what researchers have found. People with high HSCRP levels are at a greater risk of developing arthritis. The same inflammation that wears down your joints can also damage your arteries, leading to early heart disease. Even if your cholesterol and blood pressure are normal, elevated CRP can signal trouble years before symptoms appear. That means one little vial of blood can reveal what an MRI never could, whether your body is silently aging from the inside out. 3. Why this matters right before Christmas. Now, why are we talking about this before Christmas? Because this is the season when inflammation quietly spikes for most people, even those who think they're healthy. Here's why. Cold weather tightens blood vessels and restricts circulation to joints. Holiday stress increases cortisol, a hormone that triggers inflammatory responses. Sugar-heavy foods, cookies, cakes, and Christmas pies all elevate inflammation markers like CRP. Less movement during the holidays means more stiffness and inflammation buildup. It's the perfect storm for inflammation to spread through your joints, muscles, and arteries, which is why early detection right now could prevent a painful start to the new year. So, instead of waiting for the pain to get bad enough to need an MRI, you could catch it early and actually reverse it. 4. What the HSCRP test can tell you, and how to ask for it. The HSCRP test is like your body's inflammation report card. Here's how to interpret the results. Below 1 milligram per liter, low inflammation, ideal range. 1 to 3 milligrams per liter. Mild inflammation. Time to make lifestyle changes. Above 3 milligrams per liter, high inflammation, linked to increased risk of arthritis, heart disease, and chronic pain. The best part? You can request this test from almost any doctor, clinic, or lab, and it's often covered by insurance. All you need to say is, "I'd like to check my inflammation levels with a high-sensitivity CRP test. I've been having joint stiffness and want to rule out early inflammatory issues." That's it. One simple request could reveal more about your long-term health than a $1,500 MRI ever could. 5. The dangerous overlap between joint pain and heart health. This might surprise you, but joint pain and heart disease are often two sides of the same coin. Chronic inflammation doesn't just attack your joints, it also damages blood vessel walls, makes arteries less flexible, raises bad cholesterol oxidation, leading to plaque buildup, and reduces nitric oxide, which your heart needs to keep blood flowing smoothly. And that's why studies show that people with arthritis or chronic joint pain have a 48% higher risk of heart problems. It's not just coincidence, it's a shared cause. Inflammation. So when your knees ache, it might not just be your joints complaining, it could be your heart sending a signal. And the HSCRP test helps decode that message before it's too late. 6. How to lower inflammation naturally before the holidays end. If your test results show high inflammation, don't panic. You can absolutely bring those levels down, often faster than you'd think. Here's a Christmas-ready inflammation reduction plan. A. Clean up your diet. Swap out processed holiday snacks for anti-inflammatory foods. Salmon, walnuts, olive oil, and leafy greens. Add turmeric, cinnamon, and ginger to meals. They lower CRP naturally. Cut back on sugar and refined carbs, the biggest holiday culprits. B. Stay active even when it's cold. Movement keeps inflammation from settling in. Try indoor walking workouts or gentle yoga. Even 15 minutes after dinner helps reduce inflammation markers. C. Support your gut. Your gut controls 70% of your immune response. Add fermented foods like yogurt, kefir, or sauerkraut, or take a probiotic supplement. D. Manage stress. Holiday stress silently raises inflammation through cortisol spikes. Simple breathing exercises, daily gratitude journaling, or short nature walks can make a measurable difference. E. Prioritize rest. Sleep is your body's nightly repair cycle. Aim for 7 to 8 hours to allow your immune system to calm down and your inflammation levels to drop naturally. 7. What happens if you ignore it? Ignoring chronic inflammation can lead to long-term joint damage, and not just pain. Cartilage can wear away faster, increasing the risk of knee replacements and permanent stiffness. But the even greater danger? Inflammation slowly thickens your blood and narrows arteries, laying the groundwork for a heart attack or stroke. And because inflammation doesn't show up on MRIs or X-rays, many people live with this silent threat for years until it's too late. That's why this one simple blood test could literally change or save your life. So before you spend another dollar on expensive scans or treatments this holiday season, do this one thing. Ask your doctor for an HSCRP inflammation test. It takes minutes, it's affordable, and it could reveal the earliest warning signs of both joint and heart damage before Christmas even arrives. Because the truth is, health problems don't start with pain. They start with inflammation, and the sooner you catch it, the more power you have to stop it. So this Christmas, give yourself the gift of knowledge. Forget the MRI for now. Check your blood first. Your joints, your heart, and your future self will thank you.